Hi, I'm Beth Badalino-Cahill, Executive Director of Healthy Women. To stay in top shape, it's important to take preventative screenings and health practices seriously, especially as we age. Just as Pap tests, clinical breast exams, and teeth cleanings have been an important part of women's health in our 20s and 30s, there are some additional screenings we need to add to our list in our 40s, 50s, and beyond. To start, once you hit 30, if you've had 3 Pap tests in a row with normal results and your health is otherwise good, you can opt to get screened every 2 to 3 years using either the regular Pap test or the liquid-based Pap test. You also, after age 30, should talk to your doctor about getting an HPV test to screen for the types of viruses most likely to cause cervical cancer. And if you've had a total hysterectomy, meaning that your uterus and cervix have both been removed, you may stop having cervical cancer screenings. The exception to this rule is if you've had the surgery as a treatment for cervical cancer or precancer. When a woman reaches 40, she should have both a clinical breast exam and a mammogram every year. While there have recently been government reports that advocate women starting mammograms at age 50, the American Cancer Society continues to recommend 40 as the starting age. For women who are overweight, you should get a blood glucose or a sugar test starting at age 45 to check for prediabetes.
This is a simple test of your blood sugar or blood glucose, and this can be performed at your next examination, for instance. If you're not overweight, you still need to have that blood sugar checked. And if you have any questions about this, please feel free to ask your medical care provider.
In addition, if you have high blood pressure, low HDL cholesterol, a family history of diabetes, or other specific risk factors, you might need to start getting tested before age 45. When you turn 50, add colorectal cancer screenings to your checklist. There are several different types of screenings you may elect to undertake.
The first one is testing your stool for blood during that office visit once a year. The next one is having a flexible sigmoidoscopy exam every 5 years, or having a colonoscopy every 10 years. You need to sit down with your medical care provider and really have a discussion about which option is best for you.
When you hit 65 years of age, experts recommend that you get a bone mineral density test. This test will allow your healthcare professional to determine your risk of osteoporosis. Your doctor may recommend you get this test earlier if you experience a bone fracture or have other risks for osteoporosis.
All women are unique and may be at high risk for many medical conditions, and therefore it's important to sit down with your medical care provider and talk about risk for instance, diabetes, heart disease, or other health care issues that you really need to be on the red alert for. This way you can set up a strategy going forward for what you need to be tested for and monitored.
To learn more about preventative health screenings for your particular age group, visit HealthyWomen.org.